Hi, Team Canada. Nicole and I are back doing our second educational video for Pride 2021. And now we will be talking about COVID and the LGBTQ plus community.
In addition to being a danger to the health of individuals, this pandemic has the potential to exacerbate certain inequalities that exist between men, women, people of color, and people of sexual and gender diversity. This makes it imperative to address these issues. The first way that the community is impacted by COVID is through mental health and social isolation. Research consistently indicates that experiencing discrimination, prejudice, and stigma create chronically high levels of stress for minority and marginalized groups, including LGBTQ plus individuals. This excessive exposure to stress often leads to poor mental and physical health outcomes.
As we know through COVID, everyone has been experiencing the negative effects of social isolation. In Canada, the LGBTQ plus community are particularly vulnerable to the consequences of social isolation. These are people who are twice as likely to live alone as heterosexual Canadians and who are at high risk for anxiety, depression, suicidal behavior, self-harm, and substance abuse. Therefore, the LGBTQ plus community are more vulnerable to increased mental health problems than heterosexual and cisgendered people during the current crisis. The next thing we'll talk about how COVID impacts the LGBTQ plus community is our youth. School closures due to COVID may be especially challenging for the LGBTQ plus community. Many of our youth and young adults have experienced rejection from their families. And with schools closed and colleges and universities online, LGBTQ plus youth and young adults who have unsupportive families may now be at home with these families full time or must find another place to live if they haven't already been kicked out.
Some youth and young adults who were out as LGBTQ plus at school and with peers, but not with their families, may now have to choose between hiding their identities while they're at home. And as we've mentioned in our other videos, staying in the closet can contribute to more mental health issues. These mental health issues can be as severe as harming oneself. LGBTQ plus youth face approximately 14 times the risk of suicide and substance abuse than their heterosexual peers.
The third way that the pandemic impacts LGBTQ plus individuals is the workforce. Early estimates indicate that more than 5 million LGBTQ plus employees may be affected by the pandemic. About 40% of our community work in industries where they face more exposure or infection and economic insecurity. Around 15% of LGBTQ plus workers are in restaurants and food services, and about 7.5% work in hospitals. Bisexual and trans individuals are overrepresented among low income Canadians. So these individuals cannot feel like they have the financial security to not go to work. In fact, an Ontario based study found that over half of transgender individuals were living on less than $15,000 a year.
In addition to impacts on mental health and financial security, the pandemic at its core impacts people's physical health. If members of the community do get sick from exposure to COVID-19, they may receive subpar health care. Specifically, transgender and gender non-binary people are at a higher risk of poor health care than cisgender population. A 2015 survey by the TransPulse Project to inform human rights policy found that 1 in 10 trans people who accessed an emergency room had been refused care or had care terminated prematurely because they were trans. 1/4 reported being belittled or made fun of by an emergency care provider for being transgender. There is a phenomenon known as trans broken arm syndrome. It's when healthcare providers assume that any medical issues experienced by a transgender person are a result of them being trans. Everything from mental health problems to, yes, a broken arm. So when people come in with COVID symptoms, many physicians put the blame on them being transgender or gender non-binary.
Now, after hearing about all of these ways that COVID has been impacting the LGBTQ plus community, Nicole and I have put together 3 ways for allies to help. First, share if you know any healthcare providers that are LGBTQ plus positive in safe spaces. This will allow the community, especially during COVID, to get adequate healthcare. Second, read about local issues that may be impacting LGBTQ plus youth mental health, especially during COVID. For example, how Halton Catholic District School Board was one of the only school boards that refused to fly the rainbow flag during Pride Month. Finally, support LGBTQ plus owned businesses, especially during Pride Month, like those in our newsletters.